Welcome to Face the State. I'm Ariana Bennett. Thank you for joining us. We are coming up on the open enrollment period for health insurance through the state exchange now. So if you need coverage for next year, this segment is for you. Janelle Davis with Nevada Health Link is here with me to talk about that. Janelle, thank you so much for coming on the show.
Thanks for having me. Happy to be here.
Yeah, always good to have you. It's been a few years,
Yes.
So now we get to talk open enrollment 2025 for next year. What are you anticipating in terms of how many people are jumping on board this time around?
So last year, plan year 25, we experienced a very high enrollment amount. We were very successful with 112,000 enrollees, I believe. We never like to say a number of, if there's going to be an increase or decrease, but with the expiration of the enhanced premium tax credits that we're assuming will happen, we could lose some people, but really what we're trying to message people is, we want people to continue to have coverage, and it could be more expensive if you go without insurance.
So if more people sign on for this, does that make the system work better in general, bring premiums down, help get more plans online? Is that kind of like the more buy-in we have, the better it is, or not?
I mean, I think insurance works that way, right? The more people we have covered, then the healthier our communities are, right? So it's not necessarily, things are going to function better, but I think just having more Nevadans covered is our mission at Nevada Health Link and at the Nevada Health Authority.
Yeah, this is a really good point, because if people have health insurance, they're more likely to get preventive care.
Exactly.
And if they get preventive care, then bills go down because they're not seeking care in the emergency room,
Right.
when something is escalated to a
Yes.
high level. But we still have a lot of uninsured people in Nevada. We're like, high up nationally for the number, right?
Yeah, I think pre-Affordable Care Act times, we were looking at about 25% uninsured, and then once the Affordable Care Act began operations back in 2013-14, that lowered exponentially, and so I think we're looking at, depending on what you read, around 10 to 12% uninsured throughout the state.
That's a huge drop.
It is.
So there's a lot of buy-in here.
Yes.
And we've seen the exchange evolve over the years from having just, one or two providers on, or insurance providers on board, not that many plans available, to now there's a lot.
There are a lot more options this year. Every service area, there's 4 service area networks throughout the state. There's more coverage in the rules, there's more options. So we have, and more insurance carriers. We do have one new insurance carrier joining this plan year, and that's CareSource.
Yeah, I think you were saying before we started taping, there's how many different plans available now?
I think there's, we just put out a press release the other day, so it kind of breaks down into the different service areas. There's obviously more people in Clark County, and then the second being Washoe County, but there's 160 plans available.
Yeah.
Yeah.
So if you're out there and you don't have health insurance, there really is a good chance that there's something on the exchange that'll fit you.
Yeah, no, that's a good point. Really this year we're really trying to educate Nevadans to, even if you do have coverage, to log into nevadahealthlink.com and just start searching what's out there. Get assistance with a broker or a navigator. They can help you navigate this sometimes complex process. They're very educated in the plans. They work with the insurance carriers. And so we're really trying to tell people to get out there, shop the marketplace. Window shopping opened up on October 1st, and so that is going all through this month and until November 1st, when open enrollment will open.
Okay, so in the first time around, Trump administration part 1, they shortened the enrollment period and cut subsidies. Then Biden administration came in and undid that, and now we're back in Trump part 2. What is happening from federal government guidance when it comes to those things?
There is a lot of federal policy changes happening, so our team has been quick on our feet to analyze all of those changes and what the impacts are going to be, especially for this upcoming plan year and beyond. I will tell you that for this plan year, our open enrollment period remains the same. So it begins on November 1st, it goes through January 15th of 2026, and there is a 5-day buffer window for folks who completed their application but just haven't chosen a plan yet, so they'll have technically until January 20th. Pre-pandemic times is what we're going back to, or we're operating under the assumption that those expanded subsidies are going to go away at the end of this year. And so this is people who were making over the 400% of the federal poverty level. So if you were enrolled on an exchange plan, the eligibility window is usually 138 to 400% of the federal poverty level. The cost is all dependent on your household size, your zip code, where you live, how many people are applying, whether you're a tobacco smoker, all of those things. So I don't really like to throw out averages of what it's going to cost, but those people, we're basically going back to the pre-pandemic subsidy cliff. And so depending on what happens in Congress during this time frame of open enrollment, we are prepared if they do continue or if they don't. But right now, our window shopping plans have all been approved, and they are showing the no expanded subsidies. But I do want to be really clear, subsidies aren't going away. So Nevada HealthLink is still the only place where people can access subsidies, and that helps offset your monthly premium costs for health insurance.
And for a lot of people, it is a significant offset. You know,
Yes.
they might come in and think there's no way they can afford self-funded health insurance, but the subsidies bring that down to a much more affordable level in a lot of cases.
Yes, and there's still a large population of people who will maintain those subsidies, and then some over the 400% will experience an increase in their premium.
Okay.
Yeah.
Now, at the same time, we're also likely going to see cuts to Medicaid. When that happens and fewer people are eligible for Medicaid, do you expect some of those people to migrate over to the exchange or not?
Yeah, I mean, right now there's an existing account transfer process with Medicaid, and so we're kind of operating under a no wrong door situation. So whether you are eligible for Medicaid or the exchange, you know, Nevada HealthLink is your resource to help get you to the right place.
Yeah, and now all the plans have kind of a required base of the essential health benefits. So,
Yes.
so you're not gonna, worry about getting one of the junk plans that doesn't actually protect you from anything. They're required by law, right, to have all those things?
Yes. Affordable Care Act plans are required to offer the 10 essential health benefits.
Okay, so then for someone who has never done this before, either they've always had insurance through their employer or they've never had insurance at all, can you kind of walk them through the process, what they should be doing to get enrolled?
Yeah, so good question. First and foremost, I always like to tell people to visit NevadaHealthLink.com. This has a wealth of information on how to start the process. And also, you can do a lookup tool and find free assistance. We partner with over 800 brokers throughout the state, and you can put in your zip code and designate a broker in your area. Same thing with navigators. We have them statewide, and they are our boots on the ground, and they offer free assistance to walk you through the process and help you through the application, because it can be daunting. You can do this by yourself on NevadaHealthLink.com. We also have a call center that helps you through the process. And again, it's kind of a short window, so only have November 1st to January 15th to start looking at these plans and see what is out there. We really want to encourage people to, again, shop the marketplace, utilize that free assistance from a navigator or a broker, because they know these plans, they know all of the different options, and we want to make sure you're finding the right plan for your medical needs and for your budgetary needs.
And speaking of, there is a new option this time around. People might recall we've covered the Nevada Public Option that passed the legislature a few sessions ago. Now, this is the first year that they're available on the marketplace. What exactly are these?
Yeah, good question. So battle-born state plans are the same as qualified health plans. They do offer the same 10 essential health benefits. And back when this was passed in the 2021 session, there was a request for proposal, an RFP, and so the different Medicaid contracts made a bid. And so there's 3 MCO health insurance carriers who are offering battle-born state plans, who are also offering other plans on the exchange. And that is Anthem, Health Plan of Nevada, and Silver Summit, sometimes referred to as Ambetter. And so really there's not a huge difference in what the plans offer. These plans are required to meet premium reduction target rates. And they comply with all state and federal regulations, and they could potentially offer a more of a low-cost option. And another really good point that we've noticed in our preliminary analysis is that there's more options in the rural areas. So all of the battle-born state plans will be offered throughout the state in its entirety, in all of our 4 service area networks.
Okay, well, we are running close to being out of time, just about a minute left. So final message that you'd like people to take away if they need insurance or they need to re-up their insurance, anything like that?
Yeah, I would just say that we're aware that rates are increasing, costs are rising. Nevadans are faced with very difficult decisions when it comes to their budget and what to prioritize, but prioritize your health and log on to NevadaHealthLink.com, shop the marketplace. There is likely an affordable option for you, and it will be more expensive if you choose to go uninsured.
Okay, Janelle, thank you so much. I really appreciate your time.
Thank you.
Well, coming up on Face the State, a lithium mine being built in northern Humboldt County hit a snag this year that threatened its funding, but they got it all worked out. So we will check in on the progress up at Thacker Pass right after the break.